name is Carly. I'm going to be your student nurse today. How are you?
Good.
Good. Can I get your name and date of birth?
Cody Aldridge, 08/26/2005.
Okay. And then can I get the year?
2024.
And then who's the president?
Joe Biden.
Right, and then where are we today?
Saginaw Valley.
Okay. So now I'm going to be moving on to a brief health history. We're going to be doing a head-to-toe assessment today. But I'm going to get a health history on you first. Do you have any allergies?
Nope.
No? How about any current diagnosis?
Nope.
Past diagnosis?
No.
Any medications that you're on right now?
No.
How about herbals or supplements?
Just multivitamins.
Multivitamin, okay. And then have you ever had any surgeries?
No.
No? Okay. So these ones are more broad. I ask everybody this. It's more personal. Do you smoke at all? Includes vaping?
Nope.
Marijuana? No. Any drug use at all?
Nope.
How about drinking? Do you drink at all?
No.
No? Okay. So after that, I'm going to start doing some vitals on you. So first I'm going to do a blood pressure. Is there anything else I should know about before I start this assessment?
No.
No? Okay. Is this arm okay?
Yes.
Okay. And then are you in any pain today?
I am not.
Okay. So 0 out of 10?
Yes.
Alright. That's great. And can I have you flip your hand? Got 118/78. So that is a normal blood pressure. So that looks good there. And then I'm going to take your pulse. So I'm going to be holding it for 2 minutes, just to let you know. So for your pulse, I got 68, and then for respirations, I got 16. So I was watching your chest rise and fall while I was doing that. Okay, so both of those were very normal. So your vitals look normal so far. I'm also going to be checking temperature. I would normally have a thermometer, but I don't have that today, so I'm going to just check your temperature on your head. Skin is normal temperature. Your arms are normal temperature as well. So that's good. Your respirations look pretty even. I didn't know any external, like accessory muscle use in your breathing, so I don't see any problems there. And then your pulse was really even. And then now I'm going to be checking your fingers. So normally I would have an SpO2. I'd have a pulse ox, but I don't have that today, so I'm going to be checking for clubbing. I don't see any clubbing on any of your fingers, so it'd be more rounded, and that would show some decreased oxygen going to your fingers. But I don't see any of that. And then your capillary refill is coming back within 3 seconds on both, and it's very symmetrical. So that's good. So that's all for your vitals. All your vitals look normal. Now I'm going to be moving on to your arms. First I'm going to inspect your arms for any lesions or anything like that. Everything looks normal. Your moles look normal. I do see a scar, but that looks like it's healed well. How long ago was that?
About a year ago.
A year ago? Okay. Yeah, it looks really healed nicely, so that's good. Don't see any lesions on your hands either. Check this one. Temperature's good too. All the moles look symmetrical. None of them look like they're causing any issues. I don't see any problems there. So now I'm going to be checking for muscle tone, just some symmetry of muscle tone. These both look good. I don't see any problems there either. I'm going to be checking for symmetry of your radial and brachial pulses as well. So I'm going to be feeling these two. Okay, those are symmetrical and they're both beating well. Okay, those feel strong and symmetrical as well. I did check your cap refill too when I did the clubbing, so that looks normal. Now I'm going to be doing some looking for crepitus, and I'm going to have you. Do you know how to swim?
Yes.
Okay, I'm going to have you do like the swimming motion, so just with your arms, and I'm going to have my hands on your shoulders for range of motion. Okay, go ahead and start swimming. Okay, that feels pretty good. Any pain with those?
No.
No? Okay, how about going like this with your wrists? Other way too? A little bit of cracking, but not bad. Does that cause you any pain?
No.
No? Okay, and then how about you go like this? You listen for cracking? I don't hear any cracking there, so that's good. Now I'm going to be doing some strength tests. So can I have you put your hands on mine and then push down on them? Okay, and then push up. And then push in, and then push out. Okay, all was symmetrical and strength is good. I'm also going to have my hands on your shoulders and have you push up. Okay, that's good, symmetrical. So that's cranial nerve 11, and that is intact. So that's all for your arms. So now I'm going to be moving on to your head. Can I touch your hair?
Yep.
Okay. I'm gonna be looking at your scalp for any lesions. Don't see any lesions. Nothing abnormal. Is it causing you any pain or tenderness when I touch your hair?
No.
No? Okay, I'm also gonna feel for your occipital lymph nodes while I'm here too. Any tenderness there?
No.
Okay, those are non-palpable, so that is a good thing. Everything looks pretty symmetrical with your face as well. Your ears look symmetrical. I don't see any problems there. Now I'm going to be checking for your facial nerve. So I'm going to just assess that with a few things. So first I'm going to have you shrug your eyebrows up. Okay, that looks normal, symmetrical. And then I'm going to have you smile, and then frown, and then puff your cheeks out. And then can you stick your tongue out, and then go side to side, and then up, down. Okay, that looks good. So the facial expressions were cranial nerve 7. Those look good so far. Now I'm going to check sensory for that. So I'm just going to have you, it's just going to feel like this. And then I'm going to have you say where I'm poking, like left or right cheek, chin, forehead. I'm going to have you close your eyes for that.
Forehead. Right cheek. Left cheek. Nose. Chin.
Okay, so has sensory. So that's good. So function of cranial nerve 7 looked good. And then I'm also gonna feel for your muscles on your face right here. Can I have you clench your jaw? And then clench your jaw again. Okay, that's good. And then I'm gonna have you open and close your mouth. Okay, I don't feel any cracking there, so that looks good. Everything seems pretty good there. So I did 5 was the motion of you opening and closing your jaw, and then 7 was all the facial expressions. So now I'm going to be moving on to your eyes. First, I'm going to have you, I'm just going to inspect them. So you're going to close your eyes and look at your eyelids. Don't see any problems there. You can open them back up. I'm going to look at your conjunctiva. So I'm going to pull this down really quick. Those look nice and pink. Your lacrimal apparatus looks good too, so that's your tear duct. Everything looks good there. And then your sclera looks nice and white. They look nice and moist, so I don't see any problems there. So now I'm going to be looking at your pupils, so I'm going to shine a light in your eye and then see the reactivity. Okay, that one looks good. That one also looks good, so your pupils got smaller when I shine the light. Now I'm going to have you look at this pen light, and then look back at my hand, and then look back at the pen light. Okay, I was seeing your eyes move and accommodate, so your pupils got smaller when you looked closer and bigger when you got further. So that is good. I'm also going to shine the light at your nose and check for corneal light reflex. That looks good. So it's having a reflection in both of your pupils in the same spot, so that is what we expect and what we want. So that looks good too. Now I'm going to be doing some cerebellar function as well. First, do you wear any contacts or glasses ever?
No.
No, so you don't have any eye problems, you'd say?
No.
Okay, so I'm going to be doing, first I'm going to do this one. Oh, sorry, I forgot one real quick. I'm going to have you look at the pen light,
okay,
and then just move your eyes, not your head, and when I move it. Okay, that looks good. I'm going to have you, for the cerebellar, I'm going to have you touch your nose, and then the pen light, and then the nose, and the pen light, wherever I move it. Okay, you can start with your nose. And then pen light, back to your nose, then pen light, back to nose, back to pen light. Okay, that looks good. Next one I'm going to have you do is make an OK sign with your hands, and then go to your next finger, and then back as fast as you can. Okay, that looks good. And then last one, I'm going to have you put your hands on your lap and then flip them back as fast as you can. Okay, those look good too. So your cerebellar function is good. I didn't see any problems with your eyes at all. The test I did on your eyes, that is cranial nerves 3, 4, and 6. So far we have done 3, 4, 5, 6, 7, and 11. So those all look good so far. I don't see any problems with any of those. Now I'm going to be moving on to your nose. So first I'm going to just look in your nose, look at your nose. From the outside I can see a little bit of a crookedness of your bridge. Do you have a deviated septum?
I do.
Does that cause you any problems?
No.
Any breathing problems, smelling problems?
No.
No? Okay. So I'm going to have you smell this. Have you close your eyes and then smell. You smell that?
Smells like coffee beans.
Coffee beans. Okay, that's perfect. Alright, so now I'm going to be looking in your nose. Let's look at the mucosa. Looks good. Nice and wet, not dry. Everything looks pink. Your turbinates look good. I don't see any problems in there. No blockages. So the smell test, that was cranial nerve 1, and everything looks good there. So I wouldn't say there's any problems there. And then 2 is the Snellen eye chart. So that was like with the letters and the numbers on the chart that you do at like the doctor's office. But we don't have that today. but you said you don't wear eyeglasses or contacts, so I wouldn't be concerned there. And then 8, we'll do that in a minute, and then we'll finish it later. Now we're going to do 9, 10, and 12 with the mouth. So I'm going to first look at your mouth. Actually, I'm going to do your sinuses first. So just tell me if you feel any tenderness at all.
No.
No? Up there?
No.
No? Okay, so your sinuses are good. I don't see anything of concern there either. I'm going to be looking in your mouth now. From the outside, I don't see any problems. Everything looks pretty symmetrical. Okay, now I'm going to have you open. Okay. Your palate looks good. Teeth look good. Gums look pretty good. I don't see any problems at all. I don't see any cavities either, dental caries, anything like that. So now I'm going to be looking at how your uvula and your palate move. Together they should be symmetrical. So I'm going to put this on your tongue and then have you say ah. Can you stick your tongue out for me? Okay, and then say ah. Okay, that moves symmetrically, so that's good. Your tongue also looks good. I don't see any problems with that either. Do you have any sort of problems with your mouth or?
No.
Okay, I didn't see any lesions at all either. So that looks good. And then we did with the tongue movement, and then I finished it with you saying ah and seeing the phonation and stuff. You're talking well. So I'd say 9, 10, and 12 are also intact. So all we have left is 8, and we'll look at your ears. And that one is your ears, and I'll look at your ears now, and then we'll finish it later with the equilibrium part with the Romberg test. So first I'm going to be looking at if they're symmetrical. They look pretty even, so that looks good. So first I'm going to look behind your ear. I don't see any problems there, no redness. Pinna looks good. Move it up and back, and we'll look in there, no blockages. Did you have any tenderness when I was touching your pinna? No? Okay. I'm going to look behind again. No problems there. Up and back. Nothing. I don't see any problems, any blockages. Do you hear fine? Have you ever had hearing problems?
No.
No? Okay, so I wouldn't say you have any problems there either. Everything looks good there. Now I'm going to be moving on to, I'm going to do your lymph nodes. So I'm going to do your preauricular and postauricular first. We did your occipital already as well. So this is your preauricular. Any tenderness?
No.
Any here?
No.
That's your postauricular, submental, submental is here, submandibulars are here, and then your cervical chain is go on here. Any tenderness with those so far?
No.
Mind if I open this up a little?
Sure.
Okay. Just gonna have you shrug your shoulders forward. Then this is your supraclavicular in here. No tenderness with any of those?
No.
Okay, I'm also gonna check for tenting over here. I don't see any tenting, so that shows me no signs of dehydration. Your mucosa looks good, and your mouth and your nose, so I don't see any problems. I don't see any dryness, so I would not be concerned with hydration issues. So now I'm going to be looking at your neck. I don't see any use of accessory muscles with your breathing. Can I have you swallow? Okay, that moves pretty symmetrical. I don't see any problems there. Skin color looks good with that as well. Now I'm going to be feeling for your carotid arteries. Okay, so strong pulse there. Okay, strong pulse there too. And I'm going to be listening for any bruise. So that would be a whooshing sound, so it shouldn't be present. Okay, don't hear it there. I don't hear any there. So I wouldn't feel those for symmetrical because that could block off blood flow to your brain. So we don't do that with that. But I didn't see any issues there. No tenderness with any of your lymph nodes. So, alright, so now I'm going to be moving on to the back. So I'm going to be feeling for your thyroid first and then listening to lung sounds. So before we do that, do you exercise at all?
Yes.
How many days a week would you say?
6.
6 days. How long would you say you work out each day?
An hour and a half.
Hour and a half. And then what kind of workout?
I run cross country and track.
Okay, so lots of endurance.
Mm-hmm.
Okay.
Yep.
So that sounds good. Now I'm going to be moving on to your back. Okay. Alright, so I'm just opening this up. I'm inspecting first, inspecting the back of your neck again. Still no presence of any bugs or anything. Not too many lesions. See a little bit of stretch marks here. Those cause you any issues?
No.
No? Okay. No abnormal lesions. There's some moles, but those all look pretty symmetrical. Nothing of concern. How about your spine? Do you have any issues with your spine?
No.
No? Any like scoliosis or anything?
No.
Okay, I don't see any issues. It looks pretty straight, so that's good. So first I'm going to be feeling your thyroid. So I'm going to displace it to the right and left and then have you swallow. So it's right here, and then I'll have you swallow and then swallow. Okay? Any issues with that?
No.
No pain involved or anything?
No.
Okay, so that's good. So first I'm going to do some lung expansion. So I'm going to put my hands around your T10, which is the bottom of your lungs, and then I'll have you take a deep breath in and out. Okay, so what I was feeling for is if my hands move symmetrically, and they did, so that means both of your lungs are working well. So now I'm going to be listening to your lung sounds. So I'll just have you take a deep breath every time I place my stethoscope. Alright?
Okay.
Okay. Let me know if you need a break at all. I'll be asking you halfway through as well. Good. Deep breath here. 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 And here. Okay, any problems so far? Do you need a break at all?
No.
No? Okay. Alright, deep breath here. Deep breath here. 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 Okay, last two. Okay. I didn't hear any problems, any crackles or anything like that, and still no use of accessory muscles, so that looks good. Now I'm going to be percussing so you can breathe normally for this. So it's in the same half moon fashion as well. Last two. Okay. I heard resonance, no hyperresonance or hyporesonance, so I don't see any issues there. Do you have any concerns with any of the lung sounds at all?
No.
No? Okay, breathing felt good?
Yep.
Okay, so now I'm going to have you lay on your back, so you can put your head on that pillow. So I'm going to move this first. Alright, so we're going to be doing, I'm going to assess for your JVD first. So I'm going to take this pillow from you really quick. I'll give it back in just a second. I'm going to have you look that way. And then look this way. Okay, I don't see any JVD, so that would be like backflow of your blood. So I would be concerned of fluid overload, but I'm not concerned of anything with that because I didn't see that. Now I'm going to be listening to your heart. So can I have you take this off of your shoulders really quick? All right. And then, do you want to be covered up more, or are you good?
I'm good.
Okay. So I'm going to be listening in 5 spots. First I'm going to inspect. I don't see any lesions or skin issues. There's a few moles, but those look normal. So, no abnormal lesions. Okay, so I'm going to be counting your ribs, so your intercostal spaces. So I'll be listening to your aortic valve, your pulmonic valve, the Erb's point, which is the middle of your heart, and then the tricuspid valve, and then the mitral valve. And I'll be listening to both of them on each side, or on all of them on each side of my stethoscope. One side just for the basic lub-dub or heart sounds, and then for murmurs. Okay, so first thing to start with your aortic. So this is your clavicle space, rib 1, space, rib 2, space 2. Okay, lub-dub. Right, and then listening for murmurs. No murmurs. Okay, so now I'm going to move on to your pulmonic, clavicle space, rib 1, space 1, rib 2, space 2. Okay, lub-dub is strong. Okay, no murmurs. So now I'm going to go rib 3, space 3. I'm going to recount that. Clavicle, space, rib 1, space, 2, space, rib 3, space. Okay. Okay, so lub-dub sounded good. Now I'm going to listen for murmurs. Okay, Erb's point was good. I'm going to move on to your tricuspid valve, clavicle space, rib 1, space, rib 2, space, rib 3, space, 3, rib 4, space 4. Lub-dub sounds good. Clavicle space, rib 1, space, rib 2, space 2, rib 3, space 3, rib 4, space 4. Okay, no murmurs at your tricuspid valve either. Okay, so for your mitral valve, I'm going to be listening for a full minute because that is your apical pulse. It's the most reliable pulse on your body. So I'm going to be listening to that for a full minute. Clavicle space, rib 1, space 1, rib 2, space 2, rib 3, space 3, rib 4, space 4, rib 5, space 5. I'm going to check that over mid-clavicular. So that is mid-clavicular is right here. Alright, I got 62, so 60 to 100 is normal, so that is a normal range, especially because you're laying down, so it's going to be a little bit lower. So now I'm going to be listening for murmurs there as well. Clavicle, space, rib 1, space, rib 2, space, rib 3, space, rib 4, space, rib 5, space 5, trace it over. Okay, no murmurs there either. So I didn't hear any problems with your heart. So now I'm going to be moving on to your abdomen. I'm going to move this down. Okay. Can I take this off? Do you want to be covered back up top?
No, it's okay.
Okay, I'll just put it over here. Let me know if you want that again when we get up. So first I'm going to inspect your abdomen. I don't see any lesions or anything. I'm going to look from the end of the bed for everything looks symmetrical. Shape looks good. I don't see any bulging. I can see your aortic pulse, which is normal, and then I see obvious peristalsis, so that looks good as well. Okay, so first I'm going to be listening in all 4 quadrants. So I'm going to be listening one spot in each, and I should hear 3 to 5 gurgles in a few seconds. First, I'm going to ask you about your diet. What sort of things do you eat?
I eat chicken, beef, pasta, vegetables.
Okay, so pretty healthy diet.
Yep.
But do you stay away from fried foods?
Yeah, I don't usually eat that.
Okay, how about any sweets?
No, not very much.
No? Okay, so do you have any problems with your bowels at all? Like, do you have normal bowel movements?
Yeah, this is normal.
Pretty normal. Okay, cool. So I'm just going to be listening to those. Okay, quadrant 1. Okay, 35 girls. Quadrant 2. Heard a few there, 3 to 5. Okay, 3 to 5 there too. Okay. I hear adequate movement in all 4 quadrants. So that sounds good. Now I'm gonna be listening to your pulses, or to your arteries in your abdomen. So there's 5 of them. So your abdominal aortic is right here, and then I have your left and right renal, and then your left and right iliac are down there. So I'm gonna be listening for bruits, just like I did in your carotids. Okay, so your xiphoid process is right here, and your umbilicus right in the middle is your aorta. Okay, that sounded good. I don't hear any bruise there. Your right renal sounds good. Left renal, no bruise there. And then I'm gonna pull these up just a little bit. Right iliac. Okay, and then left iliac. Okay, I don't hear any bruise in any of those, so that is good. So now I'm going to move on to percussion. So I'm going to be percussing in 2 spots in each quadrant. I'm just going to listen for tympani. I'll start here. Okay, that sounded good. I didn't hear anything abnormal. Now I'm gonna find your liver border. So once I hear a dullness, that is gonna be where your liver starts. Okay, I start hearing a dullness right about here. So that is a normal spot for your liver to start. So that looks good there too. So now I'm going to start light palpation, and then I'm going to do deep palpation. Let me know if there's any tenderness or pain involved. It's good there?
Yep.
Okay. Go deep. All right. So everything felt good there too?
Yep.
Okay, I wouldn't be concerned of anything wrong with your abdomen either. So everything is looking good so far. Now I'm going to move on to your legs. So I'm going to move this camera down a little bit so I can see this. Okay, first I'm going to go up here so that you can... okay, I'm going to first do your pulses. Just because the camera angle, I want them to be able to see up here more. And then we'll assess the legs as well. So everything looks good on the legs so far, but we'll assess further in just a minute once we're done with these ones. So we're going to do your femoral pulses first. I'm going to be feeling both of them and the symmetry as well, and then listening to those for bruits. So starting here. Listening right here, or I'm feeling right there, feel it there. Okay, it's strong on this one too, it's right here. I'm going to be feeling for symmetry. Okay, both of them are symmetrical. Okay. Now I'm going to be listening for any bruits. Okay. Okay, I don't hear any bruits there. Okay. I'm listening right here. Okay, I don't hear any bruits in either of those. Felt symmetrical. Everything looks good there. So now I'm going to be moving on to the rest of your pulses. Move that down. Okay. I'm going to look at your skin. I don't see any issues with your skin. There's a few moles, those all look normal. No tears or anything. There is a little one right there, but that looks pretty healed. How long ago was that?
About a month ago.
Month ago? Okay. That looks pretty healed. It looks nice. Okay, so now I'm going to have you bend your knees up just a little bit. You can do both of them, and I'm going to feel your popliteals. Okay, those are both symmetrical. Okay, you can put your feet back down. I'm going to feel 2 pulses. Can I take your socks off?
Yep.
Okay, I'm going to feel your posterior tibialis. Okay, those are both symmetrically strong. And then your dorsalis pedis. Okay, those are both the same too. So everything looks symmetrical there. I don't see any edema on your legs at all. Temperature feels good as well. I'm gonna look at your feet. They look pretty good. I don't see any lesions and calluses, but you're a runner, so that's normal. I'm gonna check for cap refill on your toes as well. Capillary refill is coming back within 3 seconds, so you're perfusing. I'm also gonna check for sensation. So I'm going to be just doing a light and dull sensation test. So this is dull, and this is sharp. Okay?
Mm-hmm.
Okay, so then I'm just going to have you tell me where it is. So this is your thigh, calf, foot. Okay?
That's dull on my right thigh.
Okay.
Sharp on my left thigh.
Okay.
Sharp on my right calf. Dull on my left calf.
Okay.
Dull on my right foot. Dull on my left foot.
Okay, I'm gonna move under your feet.
Dull on my left foot.
Okay, so your eyes were closed during all of those and you got them all right, so you're good. So I'd say you don't have any problems with sensation. I don't see any problems with your legs at all. Also gonna feel for muscle tone while you're laying down as well. Muscle tone feels good, it's symmetrical in both, so I don't see any problems there either. I'm gonna have you sit up on the edge of the bed, just like how we were at the beginning. You can remain sitting. Okay. So first I'm gonna do a patellar reflex. So I'm just gonna have you you don't have to do anything. It'll reflex when I hit your leg right here. Okay, that one looks good. Let me redo that one. Okay, those look good. So those both look pretty strong. Your reflex is normal. So I'm also gonna have you do some strength tests. So I'm gonna have you push up on my hands with your feet, and then push down, and then push in, and then push out. So those are symmetrical. Looks pretty good. You know how I did this with your wrists? I'm gonna have you do the same thing with your ankles. Other way too. I don't hear any cracking. Those look really good. Any pain with that?
Nope.
Okay. And I'm gonna have you kick both of your legs out. Okay. I don't hear any cracking. I don't feel anything either. Any grinding or anything. Is there any pain with that either?
No.
No. Everything looks good. I did range of motion and strength, so everything looks good there. Now I'm gonna have you put your shoes on. You can do that. Move this back. Okay, so based off all the assessment data I've done so far, I feel confident in letting you stand up, so I'm gonna have you stand. Everything feel good so far?
Yep.
Yep. Okay, so I'm gonna do the Romberg test. So this is the other half of cranial nerve 8, like I was just telling you about earlier. So I'm gonna have you just stand shoulder width apart with your hands by your side, and I'm gonna put my hands right here, and I'm gonna have you close your eyes for 10 seconds, and then no any swaying or anything. Okay, I don't see any problems there. Now I'm going to test your gait. So I'm going to have you come back here for a second and have you take a few steps that way. Okay, and then back I'm going to have you do heel to toe, so just like this. Okay, I don't see anything wrong with your gait. Coordination looks good. I didn't feel any incontinence or anything. You're mobile, you exercise, you eat a lot of protein, so I wouldn't be concerned of any pressure ulcers. So I would give you a brain scale score of 23, which is the highest, so I wouldn't have you at any risk for pressure ulcers. Do you have any questions?
No.
No? Okay, everything looked great. I did a safe assessment. I don't see anything wrong. Thank you.